Welcome to Through the Eyes of She, Equity in Health, Education, Business, and Leadership for the African Woman in the 21st Century. Please utilize the chat and Q&A features on the side of your toolbar. Please use the Q&A feature to submit any questions for the panelists. This session is being recorded. Thank you.
Welcome back from the break, everyone, and thank you so much for joining today's program. My name is Fanta Traore, and I am co-founder and CEO of the Sadie Collective, a nonprofit that is focused on transforming the economics profession by redefining economics and redefining what it looks like to be an economist by centering the needs of Black women in the field. And it is a great pleasure to be here with you all today. I am also a dual degree student at Yale University pursuing a master's in policy and a master's in business administration. So today's topic is on women in tech with an emphasis on Nigeria. And we are joined by a really esteemed panel here today who are involved in the tech space and also the health space in Nigeria, ranging from medical doctors to those who are interested in redefining and centering what it looks like to include African women in the conversation of tech. And so it is my honor to introduce our moderator, Alera Roberts, and then our other esteemed panelists today. Alera Ann Roberts is a graduate of the College of Medicine, University Lagos, and started her professional medical career in private practice in 1985, rising from medical officer to hospital administrator of a private hospital in Lagos. After constantly complaining about the diminishing capacities of officers, she returned to academic life and completed her MPH in 2000, then joined the University of Lagos in the Department of Community Health and Primary Care as the Faculty of Clinical Sciences. She is presently a senior lecturer and consultant to Lagos University Teaching Hospital and is involved in teaching, service delivery, and research. Her areas of research have focused largely on child survival, childhood development, and early infant and young child nutrition. She coordinates research methodology courses at the under and postgraduate level. She's presently the second vice chairman of the Association of Public Health Physicians, Lagos State Chapter, and the Service Comm Nodal Officer for the Lagos University Teaching Hospital, which is concerned with ensuring the highest quality of service delivery for patients. She has been on the front line of the COVID-19 response in Lagos State as a member of the risk communication team and participating in health education press briefings. You'll hear more from her soon. And next up, I am introducing Yemi Awolfesso, who's a medical doctor and who has a background and expertise in clinical research and interest in neurosurgical oncology. She is a childhood cancer advocate who has published over 20 clinical and academic papers in peer-reviewed journals. She's provided content writing and editing for over 100 manuscripts and made presentations in both local and international academic and non-academic conferences. She has overseen over 50 research projects aimed at improving the outcomes of patients living with cancer in Nigeria. She is an outspoken advocate about increased medical research involvement, even at the undergraduate level. Yemi's current work at the Harvard Medical School focuses on the intersection between clinical oncology practice and the development of sustainable systems between clinical oncology practice and for academic research in developing countries. Along with sitting on the boards of other firms, Yemi is the founder and director of Research Hub, an organization that employs and trains over 200 university students and young doctors in early career research while providing funds for indigent students in Nigerian universities. She is a research coordinator at the Dorcas Cancer Foundation that has provided free cancer treatments and support children living with cancer in Nigeria and their families as they go through their cancer journey. She's also a research associate at the NSIA Luth Cancer Center. She's a recipient of the IASP Pharma Excellence Awards for African Health Startup Company of the Year for 2020, the Royal African Young Leadership Award for 2021, and the eponym of the Awolfesso Young Researcher Award. Next, we also have Dare Ladejobi, who is a medical doctor and the founder of Plateau Med. Dare Ladejobi is a medical doctor, and Plateau Med is a digital health technology company focused on sub-Saharan Africa. Plateau Med aims to combine world-class health technologies with approaches that require little or no smartphone or internet access in order to improve care in hard-to-reach populations. Their work has been extended to include COVID-19 and to address a wide range of medical conditions. Next, and last but not least, we have Monet, who is the managing editor of Tech Cabal, and medical company that provides insight on how business and technology is impacting Africa. She is a storyteller and creative writer who is passionate about helping businesses effectively communicate with their customers and key stakeholders. She's also passionate about promoting good leadership and management styles within corporate Nigeria. Without further ado, I'm now going to turn it over to our awesome panel to kick off our conversation about what it looks like to merge tech and the empowerment of African women. Now turning it over to you, Dr. Roberts.
Thank you very much, Fanta. At the last minute, I couldn't find the unmute button. And thank you to all of you that have joined us today. So we're going to kick this off very quickly because we do have a lot we would like to unpack in this very brief session. And I'm going to start by throwing it open to the key issue we have with technology in health. There are many questions that are being asked about how we can address patient dissatisfaction, service delivery glitches in terms of service efficiencies that exist beyond the scope of core clinical service providers. So I'm going to start with you, Dari, and if you would please address this, speaking about giving us some background into the Plateau Med and how it has changed things where in the areas where you work.
All right. Thank you very much, Dr. Roberts, and thank you, Fanta, for the introduction. Thanks, everyone, for joining. So first, I'd say, yes, this is a greatly laudable initiative. We at Plateau Med, what we're doing is we're picking the reality on the ground, which is you've got a ton of people who they don't have access to the internet or great access to the internet. They may not have smartphones or may share phones. But on the other hand, we want to ensure that they've got good care and that we can optimize the care that they get in those situations. Across Nigeria, of course, there are challenges. I will highlight that so far in the 6 southwestern states that we're working with, all of the key drivers of healthcare that we're working with are great leading women in those ministries of health. And it makes a huge difference when we work without, differentiating between them. When we work in states where we have to deal frankly with men, we find that we have a lower appreciation of the issues that exist. We have frankly poorer sort of reaction times. We have poorer engagement, and it just affects the results. What are the big issues we're seeing? Just to answer Dr. Roberts' question directly, the big issues we're seeing around technology in health primarily here is a lack of understanding, a lack of legislation that supports it, and by extension, a lack of an awareness, frankly, by the legal profession at this time of what moves need to be made, what policy changes need to be brought into place to ensure that companies, people who are trying to do different things in the care space are able to do those things. I'll give you a couple of examples that are, I would say, particularly cogent. For instance, we've got Dr. Omolola Salako, great woman medical doctor who's running a platform called Oncopadi. Dr. Awolfesso will probably chime in on this. Oncopadi is doing a lot in the space of cancer care, right? You've got a small handful, I'd say less than 100 oncologists in the country. On the other hand, you've got cancer patients spread out across the nation. How do we match those oncologists with the patients who need care, who are currently being seen either by surgeons or being seen by GPs or any other cadre of doctor that you find out there, which is why we're working with them to say, look, that we can ensure that when a patient has seen one care provider in the cadres of care, whether they've seen someone in a primary healthcare center or in a general hospital facility somewhere, we can then get an oncologist to review their notes and give a view as to what direction to go. But the issues around that, we have issues like, privacy of data, who owns the data, who has the rights to say someone can look at the data. This is even beyond, extending to say, hey, what exactly, even beyond the technology issues, as it were. So I'm going to pause here and just confirm that, first that you can hear me, and I'll let you take it forward, Dr. Roberts.
Thank you very much, Dari. That's very interesting what you're bringing out, and I think one of the things that I would like Monet to chime in on here. There are many questions being asked about why tech has not had the impact in health space that it has had elsewhere, and I know Tech Cabal is a Pan-African media publication, not just medical but media. So you get a lot of inputs from the so-called end users of the health space. Could you please address what you think needs to be happening, based on your experience in the media world? How do we tell a better story?
Right. So, I think that the most important thing to mention is that for a lot of founders who are interested in addressing the gaps that exist in the healthcare industry, especially where technology is concerned, their worry is adoption, right? The fact that some of the patients who need access to health tech products and services may not necessarily know how to get online or know how to use digital tools and services. So there's a big problem with trying to educate and teach people how to use health tech products, right? So once we're able to sort of cross that boundary or jump over that hurdle, I think that we're going to see more founders build services and products to address the gaps that exist. When you compare how many health tech companies exist in Nigeria versus fintech companies, the gap is quite wide. And that's because it's easier for people to adopt financial services because they're already used to a bank app versus an app that lets you schedule an appointment with a doctor or with a pharmacist or whatever the case may be. So first we have to address that. And we know that women are severely excluded from the digital economy. So we need to get them involved in that economy and then begin to address their needs. But then on the flip side, we are seeing people who are brave enough to take on those challenges and use technology as a way to do that. We're seeing that with LifeBank, for example, and LifeBank has been around for a couple of years. But when Temi decided that she was gonna go out and make it possible for blood to be delivered to people who need them, to hospitals that need them, it was an audacious task and it was a big job that she was going to be taking on. But she managed to build not just a profitable business, but a successful business at that, and one that is high impact as well. Very necessary, especially in Nigeria. So in addition to actually educating and then building these products, and a third thing that is missing is funding. Right, we need a lot more investors and VCs who are able to back health tech founders, especially female founders in the country. It's very important because these women need the capital to grow, to set up a business, to hire a team, and to put together the resources that they need to address all the gaps. And there are a lot of gaps that exist, right? We're not going to solve them in a year or two. Probably in the next 5 to 10 years, we're going to be seeing technology being leveraged to do this. But funding, we can't talk enough about the importance of funding. It's very, very important, and again, like I said, when you look at the numbers, you see that a lot more fintech companies are backed compared to health tech or even femtech companies. And femtech businesses are specifically designed to cater to women, right? For a reason, because of how marginalized they are. The fact that for some women, before they can get medical services, they need permission from husbands, they need men to be there to sign forms. All of these things play a role in taking us back into the past as opposed to moving us into the future. So as important as it is to leverage technology, we can't ignore the fact that there are a lot of moving parts, and we need help with bringing all those parts together so that founders are not doing everything, but are focusing on what's important, which is building for these gaps that exist. Yeah, those are my 2 cents.
Thank you, and I'm going to extract a lot more money from you in terms of the 2 cents. But I'd like to bring in Yemi right now, and she's got a very interesting story to tell about how she leveraged on the 3 things that we have mentioned so far. And I'm going to call it what did you call it? Femtech. I'm going to call it femtech. So for me, Yemi probably best personifies that whole. Tell us your story, Yemi, because I think from there we're going to get a lot more discussion.
Okay, thank you so much, Dr. Roberts, and I'm very honored to be able to speak on this panel, especially with all the smart people we are talking with. So, like Dr. Roberts said, and I think it's a follow-up with what Monet said during a session, is trying to identify, if we want to talk about we are getting more involvement in tech in Nigeria, whether tech in healthcare or whatever we choose to do, we have to first understand that unlike the other countries that we have, unlike the developed nations, we are starting at a different level, a different baseline than all of those other countries. It's like Dr. Roberts has said regarding my story. I started as an undergraduate and indigent student in medical school, and I got by with help from strangers, getting money here and there from basically just begging for people to pay through my school fees. But I was still interested in clinical research because, like I said, unlike developed countries, beyond the deficiencies we have in tech and health in Nigeria, we also have institutional deficiencies in healthcare delivery. So we are talking about things like case notes and how do we handle our data? Do our patients, can they even afford healthcare before we start offering them the services for tech services in healthcare instead? And then I wanted to do all this, but I did not have money to do that. And so I started this organization called Research Hub, which basically is a health tech platform to bring together indigenous students like me in Nigeria, not only to start them up on clinical research involvement at the undergraduate level, because whether we like it or not, if we start after they finish school, they are entering into a system that is already overwhelmed. So by the time they are graduates and they are young medical officers, they are either looking to get out of the system or they are too tired to work on innovative ideas that will move the system forward. So we thought about bringing all this together into a platform where not only can we offer services to evidence-based services to our patients who need it, but to also help in shaping the new generation of students. And the fantastic side effect, I would say, is that we were able to also raise money for a lot of students like me. So we have gotten to a place where if we start with the problem, we start with identifying what are the issues are, we would be able to get to the end effect, which is to raise money for the system, raise money for individuals, raise money for students and patients. So I would just say that honing down on what our problems are and identifying how we can how we can expand on innovative ideas to solve those problems is what we'll do. But we cannot just mirror advances that are currently going on in developed countries, because we have our own issues, we have our own baseline to deal with. And I don't think that we can get to that point in innovation in healthcare unless we attack the underlying problems. So thank you very much for Dr. Roberts. I will just hand over now.
Okay, so I'm going to direct this next question back to Dari, and I'm looking at the issues of monitoring and enforcing medical practice guidelines, you know, when you're talking about these tech startups. And I'd like you to use the Plateau Med as an example of what we're talking about.
Right. Yeah. Thank you, Dr. Roberts. All right. Yes. So I will answer that, and I will touch on some things that Monet and Yemi had mentioned. So I personally of the view that one reason, right, that fintechs have attracted more money than health tech is that on the financial technology side, I think what we have done is, and I use we deliberately because I think of myself as being on that side as well. I think what we have done is
I think it is pertinent to mention that Dr. Ladejobi has a master's in business administration,
yes,
and finance from Stanford.
Yeah.
So
yeah.
he's well.
Yes,
he's well.
Yes. So I think of myself as being fully on that side as well. So I think what has been done there is that there's infrastructure that has been built, right? And there's a way to regulate people. And for good or ill, there's a way to people answer for things that they do, right or wrong, right? There's a central bank, there's an SEC, there's the agent. There are all sorts of agencies that we can get into, right? And by extension, right, there are organizations like InterSwitch, right, who have gone and built an entire switching system that make it possible for payments to be seen instantaneously, right? So it does not matter. Remember when, if you had to make a payment from a bank A to a bank B, you literally had to go into bank A, collect the cash, and then walk across to bank B, down the road and stand at a queue and, pay it in. I am frankly of the view that that's where health is today. That's where we are, right? In fact, that's exactly where we are, because if a patient goes to a hospital A, right, and needs to go to a hospital B down the road, the information does not go with them. Even worse, they cannot go and withdraw their information from a hospital A and take it with them down to hospital B, right? So we're probably even maybe a decade, right, behind where financial technology was at the time I'm saying now, right? So I think one key thing that needs to happen is that we need to build infrastructure in healthcare that makes it possible to do this. And it's probably a global problem. There's the whole question of interoperability. How does data move around? And if you look in the area of imaging, digital imaging, right? It is absolutely ridiculous that there's more than one way to store digital images. And right now they don't even talk to each other, right? So essentially I can go and store an X-ray as PACS, and then another manufacturer of some X-ray machine can store his images or her images some other way. And then it's impossible for someone who's using machine A to transfer those images to machine B. I mean, the pictures, right? So one of the things we are doing at Plateau Med is we are taking our time to build what we hope is critical infrastructure. It is unseen mostly, but the first thing we've done is we've built a whole extensive database, and our intention is to make it such that, frankly, anyone who comes in the future and wants to build anything in healthcare, once you have, shown that you have the right values and you're going to behave the right way, you're going to be able to plug into that database and provide services to the patients, regardless of what hospitals they've gone to and where they're going and so on and so forth. Because that's when it gets important. Now, we feel also that, in fact, creating one or a number of ways that can talk to each other, because that's the other thing that make it possible for founders to come in and build a service, right, on top of an existing platform. We think that that's one key manner in which we can help the regulator actually regulate. Because right now, if you ask the regulators, how many patients are being seen in your state or in your local government every month or year or day even, and in fact, leave the private hospitals alone. In the public facilities, they're unable to answer those questions, right? So we've built systems that from the administrative part, we can deal with those issues. By extension, what we have also done from a clinical point of view is that we have built systems that are SNOMED integrated. SNOMED is the largest clinical terminology in the world, such that if Dr. Awolfesso sees a patient and I am going to see the patient in Spain or in Italy, so long as you have access to the case notes, because every single item in SNOMED it's got a unique digital code, then you know that I thought, or that she thought, that the patient was pale, and that the patient was jaundiced. And you know exactly what her reasoning was for thinking that this was the diagnosis of the patient. And you may not agree with it, but at least it's clear to you, right?
So I'm going to jump in. I'm going to jump in right here because there's a very interesting concept that's coming up, because I want us to address, and I need you to chime in on this, and you too, Yemi, this issue of startups and what we call pilotitis, So PlateauMed is a startup, Research Hub is a startup. Monet, how do we get out of this? Is there a need for more startups in Africa, in Nigeria, or is it time to now go to scale and tell these stories and make sure we can get them out there? Because it is clear what is needed. It is clear the answers exist. What do we do to get out of this pilotitis?
Yeah, definitely. We definitely need to see more startups transition into scale-ups, especially in Nigeria. And we know that the environment is quite difficult for entrepreneurs, especially entrepreneurs who are dealing with technology and digital technology. And one of the ways for that to happen is if we see an increase in user adoption, if we see people actually going on to use the products and pay for a premium or a freemium service. We have to remember that because income is low, it's not that easy for a lot of users to shell out money to pay for a service, no matter how important that service is. I remember with health, especially in a country like ours, people would rather self-medicate than go and speak to a professional, right? You only see that with people who, one, can afford it, or like a part of an insurance program with their company, right? But when you think about people in the informal sector, they don't have that luxury, right? So they're likely to go on the street and buy medication and then move on. Now think about this from the perspective of a woman who's expecting a child or two. Think about this from a woman who has fibroid issues, who has hormonal imbalances, right? There is no way you can go to a street pharmacy to get what it is that you need, right? And so this is where we need to see, on one hand, more startups, but on the other hand, we need to see existing startups transition into scale-ups. And when they're only able to transition when they can actually provide more services, that's how you grow. You have to stretch yourself and say, okay, we have to move beyond this product. We have to now cater to this market and this market, right? That's the only way we're going to see scale-ups happen, right? So at the moment, obviously, from the media perspective, we are speaking to founders who are running businesses like this, who have been in startup mode for a year or two, and we're asking them, what is holding you guys up from growing? And it's just that, it's that we want to build out our services, but we know that the users that we want to acquire, or the existing users that we want to transition into paying customers, just don't have the resources to do that, right? So it's a bit of like a catch-22. And I'm really hoping that one thing that I'm hoping to see from our government is that they actually support a lot of these startups. You see this in the US, especially, where at a state level, they are willing to back technology and innovation. We 100% need to see that happen in this country, whether at a state level, whether at the national level, we need to see that happen. And we'll see more high impact scale-ups after that.
Thank you. Okay, how are you going to take Research Hub from startup to scale I mean, it's
Yeah.
I've seen the amazing work that you've done. I'm so proud of you. I'm so proud of the fact that
Thank
I
you.
had some part to play in developing you. But now that we've got this bunch of clearly switched on early career researchers finding the value of applying themselves in medical research or early career research, how do we take it out of just medicine into research in everything else? Dari, you're going to come in on this because you have been amazing in the finance world prior to the start of Plateau Med. So how do we transit this from pilotitis to scale up? You've got KK, she's got a fun, she's the managing editor of Tech Cabal. So I'm putting you three together for a reason.
Thank you for the question, Dr. Robert. Yes, it's a fantastic point that was raised by Kurumani, and I think I noted 3 points on that. And the first thing will be, of course, there is a place for all of those startups. We cannot come to the place and say, oh, we are having too many startups. And even though the arguments can be made that there are some ongoing mirror effects, people are jumping into things because they have seen that, okay, somebody's starting this and it looks productive and it does look like they are making money from it, profitable. So whether we like it or not, an untold side effect from that will be more and more people will be interested in doing that. And this is where I think that we have to get to a place of collaboration and consolidating all of our efforts in developing countries like Nigeria. So it necessarily, because we have all of these good ideas, we have Dr. Ladejobi doing things that attack a particular problem in healthcare. Very important. We have different startups. We have Project Meditab that is focused on health education in Nigeria. We have Research Hub that is focused on health research. All of these attack a particular problem in healthcare in Nigeria. And I think that one of the most important things that we can do is put together all of those ideas and collaborate and consolidate. We realize that in practice, we don't have so much working across the hat with all of the ideas that we have. Everybody's working from the point of, oh, this is what I am doing, and let's see how I can scale up, which is very important, and get maybe government support and all of that. But till we can get to a point where we can develop actionable policies that will take us to where we want to go, we are going to have to work on the structure that already existing, come together and giving a big idea for more of the small great ideas that I have. And then the second thing I would also mention is we have to still keep supporting these startups because, and I think that is one way countries like Nigeria have been. But we are transitioning from that point. Up till this point, we have relied a lot on handouts and NGOs and trying to put up programs to attack the deficiencies in our health systems, which there are a lot of them. But I think that we are finally getting to a point when we are realizing that it's not necessarily it's not sustainable, and it's not necessarily going to fix the problems that we have. So we
It appears we may have lost Okwemi. So I'm going to ask Dare to chime in on that because we've got also, you've had a lot of experience working with state governments. You even have a lot of experience working with the NCDC in the startup that you did in the strategy that you did, the non-profit that you did over the COVID response and setting them up with that amazing app that they were able to use. But there are multiple hoops to jump through. Can you talk to us a bit about that? And what do we do when the government is clearly in, sit-down look mood? And how do we bypass, jump over, go under, bulldoze our way through? What do we need to do?
Okay. Yeah, thank you, Dr. Roberts. So I think the first thing we should do is accept it. That's my view, right? I think we need to accept that, you know, this is the environment, and then we need to adapt and find ways to work with it, right? A number of points have been made. Yes, we build services. Can people afford it? Again, it means our pricing models need to adapt, right? We build startups and we need to scale them, and we're thinking about certain timelines. We just need to accept that things will take a bit longer here, right, than it would have taken if I was running the same startup in the US or in Canada or somewhere else in Europe, right? Because, I mean, one of the things that I personally, that I derive energy from today is that I recall that in the first startup effectively that I was a part of, right? We started that in 2012. We did not, I mean, we did a number of things, but we didn't do our first really material game-changing thing until 2018. It took 6 years, right? Today, if you want to incorporate a business, if I want to incorporate a Delaware entity, I'll go on ClearKey or on Stripe and I'll incorporate it and I'll have everything done in maybe 24 hours, maybe even less, right? If I want to incorporate in a company on the Nigerian Corporate Affairs Commission, right, it will take at least, maybe it'll take a week, you know, that kind of thing. I mean, they'll tell you they have a 24-hour service. I've tried it. I don't think it ever takes 24 hours. I must have incorporated 100+ companies with them in my lifetime, right? So we just need to first be cognizant of that fact and design our business models to fit that, right? And accept that scaling may take a bit longer, right? Our funding models need to be cognizant of that, which means, frankly, we need to bootstrap a lot more, right? And be prepared to bootstrap. We need to design our models to bootstrap a lot more, which then tells me also that we need a lot more startups. I think there's a benefit to density, frankly, because if there are more of us, maybe, right? Maybe then we'll be able to shout loudly enough, or we'll have people among us who can shout loudly enough until we're heard. But until then, we need to continue to fight the good fight. I, for example, I'm particularly passionate about the fact that the man, the woman, the child in the village who has only edge internet, right, should be able to get care. I'm not going to wait until the telco brings 4G there, right? I mean, we will talk to the telco. We will work with the telcos. We did when we were doing work with NCDC, with the Nigeria CDC. We had to work with MTN, who are, you know, they behemoth, actually, I think is the word. But we just want to work. We have to work with what we have and make sure that when we have lemons, right, we make lemonade out of it. Yeah. So I'm just going to hand back to you now.
Thank you. KK, can you chime in on this? Because, you know, I'm sure you've seen this, and we're talking about tech in the health space, but we can be talking about any other media industry in Nigeria. And what have you seen in media in terms of the hoops that people have to jump through to start some innovative tech-based thing and get it to go up to scale? KK, are you with us? Kormone? Oh dear, I think we may have lost her. Okwemi, did you hear that?
Yes, I did.
Okay, yeah.
Okay, can you hear me? Sorry,
yes.
I dropped off a bit there. Yeah, so I did catch the tail end of the response by Dr. Ladejabi, and yes, we do need more startups. And like I was saying, we also need to get to a point where we are also consolidating all of these efforts so that we are not all just shooting apples and seeing what falls through, and then putting all of these ideas that we have together, because whether the subject we're talking about is tech in healthcare or advances in healthcare, or even basic services for our patients, or basic services for the new generation of students that we are training, we have to be able to not only work on those So we have to work from different points. I would reckon that we cannot just tackle this problem at one point. We cannot settle and say, oh, we are going to spend all this time trying to see if we can change the policies, but we have to start where we are and then try to tackle this from as many directions as we can.
Okay, so let's look at this thing in terms of a slightly wider perspective. I mean, we're talking Nigeria. We like to believe we're the giant of Africa, but seriously, what do you see are some of the what sort of perspective would you provide? Barry, I know you have some experience on this, particularly working in other African countries. How do we get past this government's private sector interface? How do we make it easier?
Well, I guess maybe I would say there's more than one way, right? One way is the Rwandan way, where you just get a great team, a great set of people, and suddenly voila, everything is working. The other way is, maybe our way in Nigeria, where you're on the other extreme of Rwanda, right? And then maybe there are midways, right? But
so we need to increase knowledge sharing. How do we increase knowledge sharing?
Yes, we need to increase knowledge share. We need to increase knowledge sharing. I think we need to show so for instance, right, if you take again the fintechs who we always like to borrow a leaf from, right? One of the reasons that there's such a surfeit of fintechs in the market is that, like Olympics, they have come in and in different parts of the market, they have shown results, right? Now it is possible to use a POS machine in a village to do a withdrawal in a place where there was no ATM machine. I mean, there are only 18,000 ATMs in Nigeria, right? And those guys have cracked that. So we just need to be able to come in, show results like that, demonstrate our results, educate the regulators, educate governments, on what we're doing, what the impact is, and as that impact, takes root, then hopefully we can use that as a ladder to carry on and achieve what we want to achieve.
So, KK, are you back with us now?
Yes, I am. I'm so sorry. My
Not
network.
at all. I know it is a function of what we're. So we're looking at it, trying to provide a slightly wider African perspective, and how, I mean, this is where Tech Cabal comes in, I'm sure, how to increase the knowledge sharing of what has worked in the femtech, in the health tech, in the fintech space across Africa. So that, I mean, we are Nigeria, but let's see how we can. We're looking at things like Paystack, we're looking at things like Flutterwave, which I know you have some experience with. How do we do this, and whose job do you think it is?
Yeah, so I think it's a mix of two different groups of people. So the media definitely plays a very big role, especially local media publications. I can't stress that enough. And that's why what we do at Tech Cabal is so important, because we're 100% focused on the continent. That's it. We just want to report tech and business news on the continent. So local media publications have a role to play. They need to go out and find these founders and find people who are interested and invested in the health technology space and are willing to get their stories out, right? And talk about the change that is coming into that industry and into that sector. And then on the other side, there is a responsibility on the founders and the CEOs or the MDs of these businesses to also be vocal about their storytelling as well, to reach out. Sometimes you have to reach out to that media publication to say, look, we've been doing XYZ, we've raised X amount of money, we've impacted X amount of lives, right? It's super important, because once we see information like that, we are very quick to chase it up, And then I also think that we need to see collaboration between, again, these businesses and governmental agencies at a state level, right? Because those guys also have the resources to spread the message far and wide, so that it's not just just one person or a group of people carrying the burden of passing information out to millions of people, right? You're guaranteed to burn out. You're guaranteed to spend a lot of money doing that, you know. So I mean, on our own end, on the media end, we go after these stories, right? I am, for example, very vested in talking about Nigerian women who are in the health tech sector, just because it's, one, a male-dominated field, just in general, and two, because it's harder for women to get capital, to get backing, to get mentorship, right? So we are interested in amplifying those voices. And we did that earlier this year when we featured two female founders, Ichora and Jenny. They run a business called Klafia, and Klafia enables people in marginalized communities, but specifically women, to call on medical health community workers to come home and come to their homes and take care of them, right? And they use USSD technology. That means that they don't need to have a smartphone to get access to that service. They can dial a USSD code. That's super easy to memorize and super easy for them to use because they're just dealing with numbers. So we want to tell more of those stories, of people who are doing things like this and building businesses like this that can help communities, especially marginalized communities.
That's actually amazing. And I'm so glad that you've now met Yemi Awolfesso and her team of early career researchers, a lot of whom are the well, they're not just medical students anymore. Correct me if I'm wrong, Okwemi. I think that what we would call the students of the health sciences, nursing, radiography, medical lab science.
Yes, we have that stereotypes.
Yeah, and the emphasis, of course, is on women. Sorry, Dari. I mean, but you guys have had it going so good for so long. You know, it's on women and it's on those who are not as financially endowed as their counterparts who have to struggle for everything they've got, so that they're not in they're traders, but not traders of commodities and things. They're traders of knowledge and research and findings and outcomes and stuff. So I'm going to thank all of you very well. And I want you all to have a one sentence end. We've got very little time left. Yeah. So one sentence. Let's start with Barry because he's the only guy in the panel. One sentence. What's your message? What would you like us to leave with?
I was hoping you wouldn't start with me. Yeah. Well, really, that we need a lot more technology in health. We need a lot more health tech founders, and we need a lot more women because, frankly, they just execute on the evidence. They execute a lot better. Yeah.
Thank you, Okwemi. You next.
Yeah, so I'm just going to, it was a wonderful session. And I'm going to end by saying that I think the most important thing for us to remember is that we should just show our results. If we can keep consolidating on the work we're already doing and showing people that this system works, then I think we'll be able to get more collaborations from people that matter. Thank you very much.
Thank you. KK, I'm going to make yours a little harder because you are here with me and with Dari. There was an interesting phrase that came up in an earlier panel, the returning diasporian. Give us a word to the returning diasporian.
I love this. Okay. What I would say is, I mean, in as much as there's a brain drain happening in Nigeria right now, what I will say though is that the diaspora is returning in a very interesting way. They're beginning to invest money in businesses back home. This is one of the best ways to increase or transform the GDP of your home country. Put money into businesses that are trying to change the country. So I'm seeing a lot more angel investors who are Nigerian born, Nigerian raised, who are abroad, who are 100% interested in backing high impact entrepreneurs. So that is, I believe, the next wave of the return of the diaspora, 100%.
Thank you all very much. And thank you everyone for attending and participating in our panel, Tech Women in Health. Nigeria is joining the game. At this time, we're going to have a 5-minute break. And if you haven't already done so, please fill the survey for this in the panel. The link to the panel can be found in the chat box. Thank you very much. Thank you for joining us.